and Ramuri from Mexico at the Native Biodata Consortium, NBDC, with the Cheyenne River Lakota Nation, a Sioux tribe. Mr. Yracheta has been a scientist since 1990, where he started as a bench biotechnician and continued in many science disciplines. In 2014, he graduated from the UW Seattle with a Master's of Pharmaceutics and Bioethics under Drs. Ken Thummel and Wiley Burke. He is currently finishing a DRPH in Environmental Health and Engineering from Johns Hopkins under Drs. Anna Navas-Asian and Paul Locke. Mr. Yracheta is passionately working to end Amerindigenous health disparity by wearing many research hats of law, ethics, policy, genomics, health outcomes, epidemiology, healthcare prevention and intervention, and allostatic load from systemic racism. Mr. Yracheta believes that all data and resources must be seen as unforeseen futures where their value will constantly change. He feels this data must be secured for indigenous economic sustainability. Thank you, Dr. Yracheta, for joining us today, and I'll turn it over to you.
Well, thank you for making me a doctor before March.
Almost there.
Yeah. So my last name is Yracheta. It's a Basque name from Spain, but I don't have any Basque ancestry. I'm a Mexican indigenous person from the Altiplano, which is Michoacan, Jalisco, Guanajuato, and Querétaro in Mexico. And my wife and kids are enrolled on the Cheyenne River Sioux Reservation. You'll see at the bottom of this slide my links to Twitter. And the title of my talk is Reclaiming Genomics and Data Science for Indigenous Sovereignty. So in reference to the previous two speakers, there's a lot of things that are of great promise with genomics and precision medicine, but there's a lot of peril as well, specifically capitalism, intellectual property, and the theft of native resources. So that's basically what my talk is going to be about, in addition to the inaccuracy of precision medicine, as Dr. Shoa just showed us, in terms of the polygenic risk scores. So this is just a close-up picture of me. I do talks locally on native radio stations, and we have done a couple of videos and radio shows. We were on Science Friday, we are on the CBC Ideas, and then we have a website where we've done some videos, and we're slated to be in upcoming documentaries as well. I went to Loyola Chicago. I worked at UW-Madison. I went and got my pharmaceutics degree at UW-Seattle, and I'm currently finishing at Johns Hopkins. I'm the executive director and vice president of the Native Biodata Consortium in South Dakota. The Cheyenne River Sioux Reservation is north central South Dakota in Eagle Butte. And I am from Chicago, and then Hopkins is on there. The rest of these are my partners and where they're located in the United States. So why is the NVDC necessary? Cultural sustainability, economy, health for both the people in the land, and sovereignty. So we all know the horrible depredations of the American government on Native American people, but what people don't know is that that is continuing today. And the strongest example is the pipeline fight for Standing Rock in North Dakota. That was 8 months long with 15,000 people. And it was not only hampered by a lot of fake news by the local sheriff's department and the state militia, but the signals and all kinds of other things to get the real news out was blocked by the US Army. So these things are still happening. It's just not talked about. So in terms of dissolution of cultural cohesion, there's lots of different ways that's happening, and it's fractionating the Native people to exhaustion. So in terms of both Dr. Clark and Dr. Cho's presentations on race and ethnicity, Native Americans are a broad group, including a lot of Latinos and especially Mexican Americans. So Native American isn't one solid umbrella, and they have different amounts of admixture. They have pre and post-Columbian differences. There's all kinds of reasons not to lump them under one umbrella, which makes precision medicine very difficult. But in terms of politics, there's a lot of talk about urban natives versus homeland natives. And currently that's what's happening with the All of Us program, is limiting the jurisdiction of native control over their own DNA only to their tribal borders and not anywhere else. Also, American citizen versus tribal citizen, they pit their own citizens against their tribal governments. American Indian versus Indigenous of the Americas, because as I said, from Alaska to the tip of South America, we share a lot of the same genome because our genomes are special and unique evolutionarily over the rest of the world's population. And then, of course, with the common rule, individual rights and consent are always at odds with tribal sovereignty and approval. This is just a short slide to show all the different ways that distrust happens, differences in values, cultural and spiritual concerns, lack of interest in research, both from both sides of the kind of research that needs to be done. And then political, as we saw with the Trump administration, he was terminating the tribes he didn't like and then giving recognition to the tribes that he did like. Unforeseen effects from DNA on federally recognized rights, stigmatization and racial profiling. They're small, easily identified by zip code and by long runs of homozygosity. And then there's the ever-present fear of biopiracy and biocolonialism. This is just one example of all the different locally adaptive traits from different small populations around the world that will mean billions of dollars in terms of pharmaceutics, and Indigenous people will not be able to take part in any of that profit. Data is the next big trouble issue. We know that in addition to publicly funded research, Google, Facebook, and Microsoft all have their own biomedical genomics programs, and the digital genome market is going to skyrocket here in the next 6 to 10 years. Also, Native Americans suffer the worst health disparities in the country. This is their own homeland. These are their own foods. These are their own lands, and they suffer the worst health care from IHS and the worst health disparity from lots of other socially determined variables. And then we always have this yo-yo between the different administrations, between making sure that tribes assimilate versus giving tribes the right to be self-governing. And in both the Clinton and the Obama administrations, they supported treaty and constitutional law by sending out executive orders. This was the last one that was done by the Obama administration to make sure that anything that was not specified in former documents belongs to the tribe. And because it belongs to the tribe, you have to consult with the tribes before doing anything that might harm them culturally, their land-based, economically, politically, and that has not been done. But here Biden is promising to reassert that commitment to tribal sovereignty. So the question should never be, how do we get tribes comfortable with genetic and other data? The question should be, how do we protect tribes if they want to share their data for their own benefit? So lately we've had all these conversations about inclusion and diversity, but that does not mean equity, because including people in studies doesn't make sure that they're going to get the interventions that they need on the other side, because the other side is all based on money. So this is what we're usually told, is that phase one, we're going to collect some wonderful data to help you for community benefit. But the second part isn't really worked out, and the federal government doesn't care or hasn't tried to work that out. So what actually has happened in the past and is going to happen in the future is that there will be not community benefit, there'll only be profit to somebody else. And this includes our DNA and other ancillary data as big data grows. What happens is, what has been happening is that even though tribes have long been the only ones with government guaranteed healthcare, they do not get good healthcare. They haven't in the past and they don't now. They get half the money spent on them per person than other people in the United States. And what happens in research often is they get a altruistic reason to participate in research, told they're going to miss out on benefits. And if they don't engage, they're going to increase the power imbalances. But instead, some of them participate, then they create research harms, and then it causes Indigenous people to disengage from all kinds of research, and the cycle just keeps continuing and continuing and continuing. There's all kinds of crises in Native American communities, including education, so that we can't do this for ourselves. The assumption is that we're incompetent and that we can't do these things for ourselves, especially during COVID. And a lot of things since 1998 and 2008, when there were 2 world market crashes, have caused people to go back into what's left of Indigenous spaces around the world to ramp up capitalism over again. So it's the second era of discovery. So basically, we are paying for your party. So how did the NBDC start? It started with a lot of young, wonderful Indigenous scientists throughout the country, in New Zealand and Australia and Canada, which we all convene at the Summer Internship for Indigenous Peoples in Genomics, which started in 2011. And then we started locally with an autoimmunity study for the Lakota. So these are my partners, Katrina Claw, she's now at the University of Colorado, and Keolu Fox, who's at University of San Diego. She's Navajo and he's Hawaiian. We were members of the UW SACNAS, which was a unique group because they were all graduate students and no undergraduate students. And we've won all kinds of awards and we did all kinds of public community service. But there wasn't a journal club for just Indigenous people. So we started one, which was just us 3. And we conceived of the Native Biodata Consortium back then. And we are glad to have it come to fruition. Singh was also instrumental. Singh has been graduating more PhDs in public health, genetics, MDs, ethics, law, because they're empowered to take up data for tribes. It's Indigenous data sovereignty, that's the movement. And we've spread through Canada, Australia, New Zealand, and soon to be Mexico. As I said, we started with these partners, starting the study of autoimmune illness in the Lakota. Those of you that don't know, the autoimmune diseases that are studied the most are European, specifically Northern European autoimmune diseases, but autoimmune diseases in Native Americans are relatively unstudied or understudied. So the NBDC, who are we and what we are? This is a picture of our lab. Actually, we have more equipment now. Our goal is to create data sovereignty, data utility, and data solutions locally by leveraging the interest in Native American data by keeping the data local. So we want to, even though we want to do precision health and omics, we want to really emphasize the other 2 bubbles, which is data sovereignty and policy and sustainability, and real community engagement, because a lot of community engagement that's going on right now is just a checked box and it's not real community engagement. Real ethics, or making ethics tailored to Native communities, because the Common Rule does not serve Native communities, advancing tribal regulation and education and capacity building. This is the outside of our building. We're the first Indigenous-led biological and data repository within tribal jurisdiction. We're a 501c3. Our board members are almost all Indigenous, and our community advisory group is only from Cheyenne River. We have many research partnerships, and we are trying to harness the power of tribal jurisdiction and authority to prevent the incorrect arguments that we're all in this together. We got donated a lot of equipment by Illumina. We have an XSeq sequencer. We have a 3-year maintenance contract. We have a 3-year guarantee of reagents to do not only COVID testing, but also sewer water capture for COVID and soil microbiome and agricultural testing. So here's a picture of the NextSeq. Here's a picture of Illumina installing everything for us. Like I said, we're doing COVID. We are including not only community engagement and policy to a CLIA certified lab. but we're also doing health education capacity and workforce development, and then sustainable health resources by collecting and keeping that data there for future projects. So we want to invalidate the presumed incompetence in our communities and dismantle the just sit tight until we get to you, which is what happened with COVID. We had to wait until August to get any tests. And by that time, South Dakota was overrun with COVID cases. So we are going for CLIA certification so that we don't ever have to wait for the CDC again, that we'll do it ourselves, and we'll take our partners' new technology under EUA and get them out into the community. We're also teaching. We did our first Indigidata last summer virtually. This summer we're going to do it in person, where we talk about all kinds of data from beekeeping to GIS or GPS data, all the way down to the microbial level. So all data and how it can be protected for the Indigenous space. These are some of the papers that
you'll find 8 publications that we.
Oops, sorry about that. These are some of the papers that we've done so far, and I wanted to call your attention to
the publications
call your attention to number 5 specifically, because the polygenic risk scores are likely not to work for Mexican populations. So just like Native Americans, Latinos are not one body. There's several different ethnicities. And so you can't lump all Latinos into one box. So our global message is we must reconcile the widening disparity between practicing science upon Indigenous people and transforming science with Indigenous people. We can no longer be passive participants in science. We wish to elevate attention to Indigenous data sovereignties that is commensurate with science's exploitation of Indigenous genomes. Indigenous peoples have sovereignty over their data. Funding agencies and universities must stop feigning ignorance over this fact. And this is a paper that we wrote in 2021, February. And I thank you for your attention.
Thank you, Mr. Yracheta, soon to be